Hello, John.
Good morning, Bridget. How are you?
I'm well. I have with me John Lowcock from Darwin, who had an unfortunate diagnosis of lung cancer early in 2022. And John has done a rather interesting thing. He has reached out to the Australian Apitherapy Association for advice on natural medicine that he could use in conjunction with the conventional chemotherapy offered by his doctor. I just want to show you, first of all, before we get started, where John is. Top of Australia in a city called Darwin, which is a fairly small city. What's your population, John?
180 would probably get to its biggest amount. It's max. It's on to get everyone else in town from out remote.
180,000, yeah?
Yeah, yep.
And what sort of medical resources do you have up there, John?
Very, very limited. Very limited.
So could you start by describing for us how you got this diagnosis and what you did?
Well, we've had diverticulitis in the past. So I just went up to hospital. That's it. Get some antibiotics for it, straightforward, and go home again. Not to be. They wanted to be a bit more thorough. Nice new hospital here. It's fantastic at Palmerston. And yes, so they wanted to do a CT scan. So the results of the scan also brought up the base of my lungs, and they discovered some spots. So that was the start of that. And I think that was back in early February, 14th or 17th, something like that. 14th, I think.
Is this the image here of the lung cancer, John?
Yes, that's definitely one of them. Yeah, that's probably at its most advanced state where it got, yep.
So what did you decide to do when you had this diagnosis?
That's it, yeah. Have a good think. That was the first thing. Yeah, that's which way we're going to go. It all pretty well started, got me going on this path, is speaking to a friend who mother dear happened to get a bit nosy and just let everybody know. And old mate piped up and said his sister diagnosed with cancer once before, and she just went on to colloidal silver, royal jelly. They gave her 16 months or something like that, and 16 years she's still going.
So what path did you decide to take? Did you agree to have chemotherapy?
That's it, yeah. God, that's one thing in the back of my mind. Like at stage 4, it's nothing to be mucked around with, and it's pretty serious, this one here, because it did move along rather quickly. And so, yeah, so we kept that in the back of the mind. But, yeah, so went back to the old apitherapy bit, back to my school days and that sort of thing, and that reminded me of venoms and everything else. And so that's where we started to kick off from there. And I think I might have come across yourself at one point in time, and that's when we hit the propolis trial.
So can you tell me what you were doing with propolis?
You're going to like this. We were nebulizing it. This, people, is my magic little box. This is my nebulizer. 240 volt, plug it into the wall. Sorry if I'm going too fast. Hasn't had it cleaned since last use, but straightforward. Plug the hose in. Fill up the bowl with your mix. I think it was the maximum amount of mix in this bowl might have been 10 mils, and I would have been adding anywhere between 14 and 20 drops of propolis tincture in there. And once you've got that, out on. They do come with a mask. I found this here more convenient to use. So yeah, just pop that in your mouth, switch it on, of course, pop that in your mouth and inhale. And there's my propolis tincture.
So you're nebulizing propolis. What other bee products did you start using?
Oh, that's, yeah, the propolis capsules, the jelly, yeah, all that's it. And then we moved on to bees and bee venom.
Did you have trouble getting bees in Darwin?
Oh, mate, yes. Yep, took a little while to find some. That was the biggest problem. That's when if you go back and look at those pictures, you'll see what advanced a fair bit. Everything advanced, actually. Not to worry. But yes, yeah, so once I got the hives in, that was all cool. We started doing that. Yeah.
So can you describe to me what you did with the bees?
Yes, started on the knees. I get apart from going out there, catching them first, bringing them back in, putting them out with a pair of tweezers and putting them on an area. But yeah, I've got crooked knees. I had crooked knees.
How many bee stings did you give yourself every day?
Averaged anywhere between 20 and 30, probably 25 you could call it, maybe 27. It's probably on the higher side towards 30 all the time. And I'd say 54 was my maximum. That's only because I ran out of bees. I just wanted to give the system a bit of a shock.
So can you tell me what happened when you were stinging your knees with bee venom? What happened?
My knees are repaired.
What can you describe that more for me, please?
If you can go the previous reports from radiologists about having bone on bone and osteoarthritis, that sort of thing written there. And I'd be going to spend 20 minutes walking around with a walking stick. That's it. After that, I have to sit down for 5 minutes and then get up and go again. I have to stand at the front of a boat now and flick all day.
So do you mean that your knees repaired as a result of those bee stings?
Something's happened to it, yes, definitely. Yeah, no, it's fantastic. I reckon I could go back and kick the football again.
Okay, so you decided to have chemotherapy. What did the doctor warn you about the side effects of chemo?
I didn't have to. I'm pretty aware of that stuff myself. So, yeah, I just don't want it in the system. As we know, at the end of the day, the cure is going to kill you. So
there was an issue about your oxygen levels. How were your oxygen levels and what did you do to manage that?
Mate, that's another story. Probably coming a bit early, but that's all good. But basically what happened with the oxygen levels was a lung infection. And the lung infection, possibly it may have been brought on by inhaling venom straight into the lungs.
Oh.
I don't recommend anybody do it. It's not the nicest feeling in the world.
So you inhaled bee venom, and you don't recommend that? That was something you did completely as an experiment, yeah? That
was a powder, yes, yeah. Well, that's it. I just figured, well, we breathe in that much dust and stuff and everything else in the world, you know, whatever. I just figured, well, it can't hurt if I can get it to the back of my throat without it collecting on my tongue and on the sides of my mouth and that little thing, the handstand in the back of your throat. I can't remember. Yeah, if it doesn't hang on that, it's good. But yeah, so that was the idea, is just to try and direct it to the back of the throat and get it down there.
So what else did you do with the bee venom powder, John?
Oh, that's it, yes. In between a couple of treatments, the 3 treatments I had, they didn't want me stinging just for the risk of infection from the bee itself. So that's it. I was just, yeah, probably throwing a gram or 2 underneath the tongue every night as well, just in the hope of trying to keep the malignant level up and happening.
Okay, so let's have a look at your result from, we saw this earlier image. I'll just show again. This was your original image. And if I stop that share and show your, I think, is this the image that you had on the 1st of December? And can you describe for me, is this how the cancer is looking now?
That's the 1st of September. That was the most recent scan, yes. What it looks like now, who knows? Yeah, yep.
Can you describe for me what's going on here?
Anything that's in that top part of the screen where you've got your little hand there, the pointer, you can see my ribs. I'm actually lying on my back. The top of the screen is where my head is, and of course that's my arms going up in the air. And so you can see where the ribs have been trimmed away, and the black area above the white bits, that's actually the lungs. So wherever it's showing black in there is the lung, which is all good. Wherever it's not, it's cancer.
So what you can see is that the tumour has reduced significantly. Is that what the doctor told you?
Oh, we've killed it off, mate.
So we have a look at, we've got the doctor's report here. I'll just share that. The doctor's report says that There are no hepatic metastases.
None.
There appears to be significant improvement since the previous study on the 23rd of June in response to therapy. It says the primary tumour in the left upper lobe shows significant reduction in volume. Further reduction noted at the right-sided pulmonary nodule. Most nodules now showing central lucency. No metastatic disease to the liver, adrenals, or bones. No intracranial disease.
And it's interesting that they mention that, because all my lymph nodes have been affected, all 7 were affected. The ones in the left-hand lung, which of course is on the right-hand side of the screen, they've been affected pretty much the whole time. So that's 4 of those have been affected. And they've already been starting to be eaten away, at least a quarter.
So John, can you tell me, what do you think, what do you feel about using bee medicine, using apitherapy to treat your lung cancer? How do you think it's helped you?
I reckon it's an excellent foundation. That's it, mate. A good building block, for sure. That's it. Yes, not regretting it one bit. That's it. I've got a hive out the back of my own now, and just keep it up. And I have no doubt that it's been essential to my treatment, as far as I'm concerned.
So the doctor told you you're getting better, yes?
Yes, yeah. Yes, it was different when he said that, John, you are getting better. That was without the pictures. I think that was, might have gone back to the 20th or something like that before that scan was taken, so yes.
Do you mind if I show a little rundown of what you've actually been doing? I'm not sure if you can see this. I'm just going to try and share that on the screen. I think people will be very, very interested in how you've done this. So I'd like to, if it's possible, I'll have to sort of try and get that image up. Can you run down what you actually did?
Yeah, pretty much. Yep. Okay. So yeah, like I said, I started off with raw jelly, colloidal silver, because it's quick and easy to get here. As I said, we discussed propolis. So yes, we moved on propolis, colloidal silver, and raw jelly, nebulizing as well as the capsule. That's it. And still nebulizing, still capsulizing, still colloidal silvering, still raw jelly. We moved on to lay trial. I couldn't get hold of any bees or any bee venom. And so we worked with the capsules for a while. There wasn't much happening there. From memory, I didn't feel anything. So we moved on to injecting it, and that came compounded already. So that was good. So yes, and it's started on your herbals. I was Apitherapy Spa as well. It's yes, about that time. And then I found some beehives, or at least 2 beehives, and yeah, I didn't want to wipe them out, so I knew I was going to be hitting it hard. So that's those a day, yeah, that's for sure. So it was getting hard. So I was doing that, and I decided to take up some Brazilian wasp venom. That has molybdenum in it as well as Apis mellifera, and yeah, it attacks the cell in a different way. So I just thought maybe the combination of the bee stinging with the bees wasp, with the layer trial, with the capsules, with the nebulizing. But yes, it must just fallen that far short. It wasn't funny. And also that time was when I started up the bicarbonate and blackstrap molasses treatment to get the alkaline system up and that sort of thing, which we had to stop and go back to a regular diet, because I did 10 kilos in 2 weeks. They weren't very happy about that. I lost 10 kilos.
So you've managed your own self-care extremely well, and you've been very adventurous, sometimes extreme. What would you recommend to people if they had your diagnosis after what you've been through?
Don't inhale the venom. But yeah, that's it there. Well, that's it. Then there's other things as well. I was doing iodine and peroxide, nebulizing that, and there's probably a couple other things out there as well. I did nebulize colloidal silver as well. Lots of different little things.
Well, anyway, congratulations on your amazing result. It is a remarkable outcome, and you've been very courageous and taken it further than most people would go. So we really appreciate you describing your diagnosis today. Thank you very much.
Too easy.
And
would
stay well.
Would you like me to grab you a bee out?
Oh, that'd be marvellous. Have you got one handy?
I'll give it a go. I've done my shoulder in, so I'm going to have to try and catch him in my left arm. So it might take a little bit, but they've had here for good, probably 40 minutes, so they should be pretty dull.
Have you found that that you've been reaching for the bees when you've had pain? You've been doing some...
Yeah, well, now that you've gone and brought that subject up, we'll go back to our wonderful Palmerston Hospital yesterday. I've actually just found out that I've got full-blown osteoarthritis in my right-hand shoulder. And so hospitals being hospitals, they don't want to give you anything to fix you up. You have to go see your doctor for that. So I came home with no painkillers, no nothing basically that's suited for it. And so I stung myself last night, and it was the only thing that gave me relief. Admittedly, the relief might only been for a couple of hours, but it was relief, that's for sure. So yes, and so I got my 3 hours sleep in, I think. I got up later, and I thought, oh, I'll go outside and get some bees. Don't do that at night.
Okay.
It's dangerous. It's dangerous. So I managed to get 3 stings in it, and that settled it down again. But yeah, pity I just didn't get back to sleep. That's all.
Okay, let's go with the bee stings before this call runs out.
That's it. It's definitely made life easier to manage. Reasonable amount, any. Plain as tape, it'll do. Oh no, little things. So yes, there we have one beautiful little girl. When do we want it? I'm just on the arm. Straightforward. Him up, put him down there. He'll sit there. Bingo. He stuck me.
Thank you, Bee, for your medicine.
Yeah, pity they die. Hey, off you come, girl.
Thank you very much, John. That was really great. Really appreciate your telling us about your treatment, and
yeah, if it helps someone else out, why not?
Yes.
Cool bananas.
Well, you're a complete inspiration, and congratulations on your brave self-management.
Mate, what do you do? I'm here. I've got no resources. When it comes to the wasp venom, I had to compound that myself. And to do that sterile and that sort of thing as well as another. It'll feed on its own, as well as getting the melittin out and keeping that sterile and that sort of thing, you know. So that was basically just the tent and nitrogen. So,
can I just ask you, did you expect to be so successful with your treatment?
Something had to happen sooner or later. Something's got to give. That's it. And that's the other thing too, is yes, this benzodiol, mate, it loves working with the bee venom as well. Yeah, that's another one. So yeah.
But were you surprised when you found out that the tumours were shrinking? When the doctor had what did the doctor say to you in the beginning about your prognosis?
Oh, that's 12 months. Oh, sorry, 18 months without treatment, 23 months with. That's my life expectancy. So yeah, 23 months. And
what do they say it is now?
Oh, no idea. No idea. I'm not going to even enter into that with them at the moment. So yes. But the other thing you've got to be remembered here too is bee venom's a real bugger because it gets rid of all your symptoms. So there's 3 times I thought I had actually advanced and gotten rid of it, when in actual fact it was completely the opposite. Yes, that was rather frustrating.
So are you saying that the bee venom made you feel well and the cancer was actually progressing?
Correct. Yes, I didn't have the nausea. I didn't have anything. The only thing I had was a cough.
So in other words, taking the bee venom supported the other treatment you were getting, so you weren't feeling unwell.
Oh, that's right. Yeah, that's it. Yep, yep, yep. No effect from the chemos or the immuno they were putting in me. None whatsoever. Maybe, I shouldn't say none whatsoever. There probably was a little bit of effect maybe towards the end of the week, but it's just hard to say because it could have been die off or anything happening at the same time. But there was no immediate impact.
Have you tried to tell people how you're doing this, and what's been the reaction?
Well, that's it. Yeah, they just laugh. That's it. Yeah. I think it's a joke. Yeah, you get that. Some people can remain ignorant if they wish, but yeah, no, that's cool. But mate, like I said, it just must be that close to getting rid of it. If it can knock off all those symptoms, it must be just that 15th away. That's why I'd love to give it a go. I drip with the other method I'll talk to you about. So
Yeah. Anyway, congratulations again.
Thank you.
Stay well. Stay in touch, and I'm sure we'll keep talking.
Okie dokie. Take care.
Thank you. Bye.
I hope you enjoyed that presentation with John. I really commend him for his bravery on multiple levels, especially sharing something so intimate with us. And we'll be curious to hear afterwards how everybody thought about this. Today we are here to talk about cancer. And what is cancer? Many of us know that the astrological sign for cancer is the crab. And why is cancer named after a crab? Well, the early pioneers of dissection, when they discovered and dissected bodies at the beginning of the scientific revolution, they noticed that the tumors had these claw-like tentacles going into the different tissues of the body, hence the name cancer. There are a few features of cancer that I'd like to talk about, and I'll use a few analogies. But when we have a cut in our skin, for example, the cells of the tissues are separated, and when the healing process begins, they grow back together. And when healing is complete, the cells touch each other and they stop dividing. What happens with cancer are a number of normal cell programs stop working, so that when cancer cells butt up and touch against each other, they don't stop growing, they keep growing. And in order for the cancer to progress, it needs a blood supply. Many of you will be watching my talk later. I'll be talking about the connective tissue element or the interstitial elements. But a lot of that has to do with getting blood supply to the cancer so that it grows. Cancer has to do other things before it becomes really prevalent and dangerous in the body. One of the things that happens is something called diapedesis. That is where the cancer cells, the word pedesis comes from the Latin or Greek word for pedal, and the cells literally get up and they start walking around. It's called diapedesis, and that's what causes metastases. So basically what cancer is are certain normal cell processes that keep the body functioning and regulating properly get turned off or get switched in different ways, and that's how the cancer develops. Initially, it may develop rather slowly. For example, in the case of colon cancer, it may take 20 years from that first cancer cell to develop to the size of a grape. It might take 20 years for that one cell to grow to the size of a grape, but once mechanisms are in place and blood supply to the cancer begins, from the size of a grape to a football size can only take 2 years. So cancer, much of the time, is a slow moving process. I typically think of cancer in 3 phases. The first phase I consider most important, and that's the preventative phase. I think both natural therapies, including anti-inflammatory natural therapies, cannabis, and the endocannabinoid system are my wheelhouse. I think apitherapy has something to do with reducing overall inflammation. Eating good fruits and vegetables with plenty of fiber we know is preventative. So there's a preventative piece to cancer that I think is highly important in health. Then we have an active cancer phase where there's typically we thought of as the type of cancer that we're trying to fix or cure or help the patient extend their life. And then we have a terminal phase. My feeling is that natural therapies have a role to play in all of these, but for the purposes of today's talk, we'll focus on mostly that middle piece with active cancer where we're actually trying to either bring it into remission or potentially even cure. Cancer is a very difficult topic to talk about. It has not only a scientific aspect to it, but it also has a political, not just scientific, and also cultural elements. My specialty is on the CBD side, so I'm not such so knowledgeable about apitherapy or the B side. But let me talk a little bit about cancer, and I have a few notes here. First of all, we've got the beginnings of a body of scientific literature on cancer. And cancer patients in general, this comes from a study from the Journal of the American Medical Association. So it's a very well-respected, high-tiered journal. Cancer patients using cannabis have better quality of life compared to those who do not use cannabis. Cannabis patients patients with cancer using cannabis experience decreased anxiety, decreased pain, decreased depression, as well as increased appetite and well-being. Why is the appetite so important? Part of the problem with cancer is it turns off mechanisms that stimulate our appetite, and the patient can grow skinny. And about 1/3 of cancers, the patient gets very skinny. What ends up happening is the size of the tumor mass becomes so large, our bodies have to feed the tumor, that tumor starts stealing all of the nutrition from the body, from the normal cells of the body, and using that to grow itself. So the stimulation of appetite is a very, very important piece to enhancing the life of the cancer patient in that middle stage where we're still trying to effect a cure. The beautiful thing about cannabis and cannabinoids is that they can be used simultaneously to help with nausea and vomiting if the chemotherapy is engaged. And a lot of our conventional pharmaceutical medications that use drugs to stimulate appetite, believe it or not, sometimes may stimulate appetite, but for whatever reason, the weight is not maintained or gained. Cannabinoids have this very unique feature. There are so many types of cancer. Even within lung cancer, there are different types of breast cancer, for example. But just in general, cancers that exhibit sensitivity to cannabinoid therapy include brain tumors such as glioblastoma, astrocytoma, and neuroblastomas, as well as skin, liver, pancreas, and breast cancers. We have the beginning of a body of literature showing anti-cancer properties, not cure, but anti-cancer properties with these. And a part of the terrain of cancer involves the connective tissue or the interstitium. So remember this when you're watching my presentation a little bit later today, because things might start to make sense. But this connective tissue or interstitium is the terrain in which all immune processes occur. And so part of what cancer does that's really tricky is it fools our immune system and literally almost becomes invisible to the sentinel aspects of our immune system that are generally good at picking up a cell that's infected with a virus or a cell that's or a bacterial infection in the tissue. our surveillance system with cannabis is taken down. So one of the beautiful things that cannabinoids will do is they help with that aspect. If we take THC, for example, which is the psychedelic molecule, there are many molecules in the cannabis plant that have potential applications for cancer. But the THC molecule does something in cancer cells that it doesn't do in normal cells, and that's raises the levels of a chemical called ceramide. It's part of the sphingolipid pathway. And so when THC is hitting the cancer cells, these ceramide molecules pop up, and that allows our immune system to all of a sudden, the cloaking that was invisible, these cells become visible to the immune system, and then they can be targeted and killed. It's something called apoptosis. Looks like apoptosis. People pronounce it in different ways. So in that respect, THC can be very potentially helpful as it possesses what we call anti-cancer properties. Again, just to be clear, we're not talking about cure. CBD does something that's a little bit different. We saw in John's CT scans, which were those three-dimensional slices of the body, where certain aspects of the lung tumor showed up as white. Those are likely calcifications. So not only is the ceramide different in cancer cells, but the calcium metabolism is different. And part of that calcium change in the cancer cells also contributes to the invisibility of cancer cells to the immune system. Instead of THC in the prior example that I used, CBD has remarkable qualities in how it affects cancer cells' calcium metabolism. And so similar to what THC does on the sphingolipid ceramide side, CBD will be doing on the in terms of the calcium regulation. So a lot of the times it's good to combine different therapies. This is what is frequently done in the most cutting edge cancer treatments today. For example, with complex cancers, oncologists will, instead of, in the early days, they just used one particular chemical compound to try to kill the cancer and hope the rest of the body survived. What we've learned over time and study and through much human and animal suffering is that utilizing and attacking the cancer from multiple sides at the same time, we can lower our dose of the toxic chemical compounds and enhance the effectiveness of the anti-cancer properties of the chemotherapy. Plants work the exact same way, which is one of the reasons why CBD is phenomenal. And apitherapy also works this way. There are innumerable aspects to the chemical composition of honey, for example. My understanding from speaking with Dr. Stefan is that bee venom is typically fairly consistent, but has minor fluctuations, royal jelly. But nonetheless, all of the different bee products are going to have different aspects. So one of the ways we can support the patient with natural medicines is utilizing not only formulas that have different chemical compounds, such as cannabis does, but also multiple approaches, as in the case of apitherapy. So that's the cell destruction piece. Additionally, cancer does require a blood supply. So what one particular cannabinoid does, and I believe it's CBDA, and I'm just going to check my notes here, but it turns off something called angiogenic growth factor. Angio means blood, genic means generated, and so it turns off the molecular mechanisms to the cancer cells that cause blood supply. Very, very interesting. And then a different cannabinoid prevents diapedesis. So we are now beginning to see in the literature some very interesting studies and reports on cancer. I'm just going to go over a few of them. One is a particularly brutal type of a brain cancer called glioblastoma multiforme. And this particular study used a cannabis with equal amounts of CBD and THC. And what was found was that patients who were using cannabis with this particular disease had an 83% one-year survival rate, compared with 53% for patients who did not use cannabis. What did this translate to? It translates to the median CBD THC group had an average of 550 days that they lived versus 369 days in the placebo groups. So patients using cannabis lived much longer than in the placebo groups. Some of the things that the authors of this study said were that what was really cool is that the combination of CBD and THC actually affected, they think was affecting the efficacy of the chemotherapy. And the authors say, again, and I quote, moreover, the cannabinoid medicine was generally well tolerated. These promising results are of particular interest as the pharmacology of the CBD THC product appears to be distinct from existing oncology medications and may offer unique possibility of a synergistic options for future glioma treatment. I think that we, in the utilization of natural medicine, bee therapy, and cannabis are two wonderful partners that work well together. At last year's conference, Dr. Bridget Goodwin discussed how the Egyptians combined this use thousands and thousands of years ago today. Some other cool studies. We have to be really careful when we use animal studies because they don't always correlate or correspond. So let me finish this thought, and I hear Dr. Stefan is with us. So this is CBD from marijuana or cannabis plus chemotherapy. So again, we're having the combination of the natural therapy with the chemotherapy, tripled cancer survival rates in mice. And I'm so grateful that Dr. Stefan is here because I'm really not, I'm a bee aficionado and I love bees, but I'm not a bee expert. So Dr. Stefan, are you with us?
Yes, I am. Can you hear me?
I can hear you wonderfully. I'm glad to see you here.
Perfect, perfect. So you are not yet an expert in bee therapy, as you said, but you'll be for sure because you have already everything you need. This concept of using natural products holistically is the most important part, especially in a case like this one with John. Okay, a few ideas regarding to this case. When I have a patient with cancer, I'm telling him that in most of the cases, like 95% of the cases, the people are not dying because of the tumor itself. The tumor itself, as you said, Jake, it's a kind of parasite. If you feed the body, you give the body everything it needs. You feed also, let's say, the parasite. But if the rest of the body is well nourished, the immune system is strong, then that parasite, it doesn't matter. So that kind of parasite, that kind of tumor may be dangerous if it develops in a place like trachea here, or here on the brainstem, or it's sometimes, but it's extremely seldom, it grows into the heart, or these are only the cases where it blocks, let's say, the aorta. But all other locations of the cancer, like John has now, allows the body to survive. If, let's say, like in the case of John, the lung cancer affects the left lung too much, the surgeons can do lungectomy, like they can take out the left lung, and John can live another 50 years with the right lung, if everything is okay. If the tumor, for example, goes to the liver, you can take out of the liver like 90%. Still with 10%, the patient can still live 50 years. Of course, it cannot run marathon or do exercise or eat a lot and so on, but it can live. So the body is oversized, and in this respect, so the most important thing here is to prevent the metastasis, because the metastasis may be the problem. Once you have thousands of parasites, small parasites like this, then it can turn into a problem. But when a cell goes out of the tumor, as we know, the tumor cells which goes out, they are not having that protection a bigger tumor has. So the immune system, if the immune system is strong enough, it will recognize these metastatic cells and it will destroy them immediately. Now, to destroy these metastatic cells, there are a few things to take into account. First of all, the immune system needs a lot of energy and a lot of speed and a lot of fluid, lymph and fluid blood in order to move very fast into the body. Okay, so people which are colder are not moving enough, or they have a diet which is too heavy, too cold, are not going to go well. And people who are exercising, people who are doing like having hyperthermia, like the body being warmer than other people, like is the case with the beekeepers. So once you have hyperthermia, you have this larger energy in the body, and the immune system can work very, very fast. Now, another thing is this combination, as you said, Jake, very well, this combination of all these products, and it's wonderful, the protocol, which I'm sure was coordinated by Bridget for John, is that when you give, you have bee venom therapy, bee venom, when it comes into contact with the cancer cell, according to a study, makes kind of 24 holes into the cancer cell, into the cancer membrane, 24 holes in this metastatic cell, cancer cell, yeah? But in normal cells surrounding, the same melittin, which is the main component from bee venom, makes only 4 holes. So a normal cell can regenerate at the membrane level, but the cancer cell cannot. Cancer cell just explodes. Okay, so bee venom should be continued by John. Now, what I would suggest in his case, like he takes bee venom sublingual, it's a very good idea. He should continue with the bee stings, maybe like 50 bee stings, or even maybe more, 60, 70, 80. He's already immunized to bee venom. But the most important part is to put these bee stings on acupuncture points, which are related to the lungs, or acupuncture points which are related to meridians, which are helping the immune system and all the rest of the body. So not just random applications. It was okay to fix the knee, but now he should go more on these points, on the thorax, on the back, and so on and so on. Okay, now another thing is that in the case of cancer, we noticed a bit in the presentation of John, there is this factor related to depression. And as you mentioned, so cannabinoids and all this kind of therapy is helping against depression. And so is doing all bee products. All bee products are acting more or less with different mechanisms against depression. One other thing, his structure, according to Ayurvedic diagnosis, you notice it's a bit slower, the body, it's a bit heavier like structure. So it's more or less like Kapha dosha type. And Kapha dosha type is like the bear type. which needs more heat. So again, this idea with exercise and so on and so on. Psychotherapy, I would use also more psychotherapy, especially against this possible depression. And then another thing is he can use also pranayama. Pranayama is a technique from yoga, breathing technique, because if he has a very good ventilation into the lungs, then the immune system in the lungs, it's improved. So the danger is when somebody stays depressed, the breathing is shallow, and then it's not enough oxygen, all these tissues into the lungs. Okay, what else is in cancer? We know that although the telomerase in cancer cells, it's stable, and this allows the cancer cells to regenerate very fast. But the problem is that the rest of the cells in the body, when they become depressed, the telomerase in these other cells of the body, like immune system and so on, goes down. So what I would suggest to John is to add to his protocol also bee pollen. In my presentation a few hours ago, before, I showed one study from Czech Republic. They found out in pollen telomerase. And telomerase helps this regeneration of the normal cells and may even inhibit the telomerase from the cancer cells. Okay, so pollen, fresh frozen pollen should be used. And again, about the diet, here is very, very important because we give the bee products a certain amount, like maybe 50 grams, 100 grams, 200 grams a day of altogether bee products. But the patient eats, let's say, 2 liters of foods or drinks and so on. So if this diet is not perfect, it may bring problems. Now, it's okay to have a diet which is more vegetables, fruits, and so on, but we should be a bit more specific in the sense that we should avoid those foods which are too sticky or too cold. For example, gluten, it's a kind of very sticky substance, and this goes also into the capillaries and make the blood flow and lymphatic flow slower, so the immune system is slower. It's slowed in his movement. So gluten is not a good idea. Everything with sugar is not a good idea. Cholesterol too high, like from red meat and so on, should be avoided. But also the cold foods, like if in that part of Australia is still very warm. So John may have a tendency to drink like cold drinks or maybe some cold food sometimes. And cold does not go well with tumor. So again, he needs heat, movement, exercise. Okay, so for my patients, I give a very simple practical comparison. I'm telling them that the food which is fluid in the container, like a cup, like you are drinking now, Jake. So if the liquid stays fluid in the cup, it's okay. But if the fluid, that drink or food, sticks to the interior of the cup, for example, the cream from the milk, okay? That thing which is sticky on that part will also stick into the body if you take it on a longer time or medium time. But a food or a drink which is very, very fluid, for example, yogurt is much better than cream. Yogurt is much more fluid. So anything which is fluid, it's to be used more. Now, to increase this heat of the body, there is another system in also in diet therapy, in Ayurveda, in Chinese medicine, is to take some spicy foods, which turns the body more heat. Like when you take maybe not pepper, chili, or these things which are too hot. There is a principle in Chinese medicine. If you get too strong yang, too hot, this goes into yin, because the body reacts to this excessive heat and comes with cold mechanism. But moderate spicy foods like curry, turmeric, mustard, onion, garlic, and so on and so on, all these moderate spicy foods would be fine. And important is one of the signs which shows that the body is well heated is you look to the tongue. For example, my tongue now, it's whitish a bit. which is not good. I took some yogurt before, but if the tongue is whitish, it shows coldness inside the body. So when you take these spicy foods and propolis and bee products, the tongue becomes normal red, and this shows a good blood flow, a good energy in the body. So the patient should avoid having the tongue whitish. Okay, what else? It's here about the propolis I wrote down. So John is using very, very well propolis through nebulization. Now, I would suggest to add to the nebulization with propolis a bit of honey and also some essential oils, which can be selected by naturopathic doctors like you to act against the tumor or against the infections, preventative and so on. But I would give also propolis also through suppositories, not only through the lungs. So there is a principle we use in apitherapy, which is to use all anatomical ways to stimulate all the body. So breathing is wonderful because you act topically, but he should attack the tumors also from the blood. So when you come from the blood or through the blood with propolis, with bee venom and so on, you attack the cancer from two directions. So it's maybe a better kind of interaction. So yeah, so John should continue all these things, and maybe another thing he can do is to do this kind of Chinese or Ayurvedic diagnosis, to go to all levels of his body, energy levels and psycho-emotional areas, to find some other maybe weak spots and then correct these weaknesses, because there are many possible weaknesses. And if you correct these weaknesses, you are acting just preventative. So this is important. And in apitherapy, in phytotherapy, aromatherapy, nutrition, yoga, and so on, there are so many good methods to adapt to all the situations. So these are my thoughts in a fast manner said. And maybe, Jake, if there are some questions on the chat, maybe we can answer them or interact with other people, or maybe Bridget can also join us if she has no technical problems. Or maybe John, by the way, John is with us now, I don't know. Maybe we can speak with him too. Okay, so, okay. Our participants can write on the chat here if they have any questions. And I noticed in the participants there is one gentleman from Germany who is very passionate, like you, Jake, on cannabinoids, on marijuana, and all these things. It's Daniel Teufel, and it's good to have the synergy between more people.
One thing, since we have a bit of time, Dr. Stefan, you mentioned the metastases piece, and one of the things that a lot of folks who don't know much about cannabis are aware of is that there's very different properties between the fresh leaves of the flower, the fresh leaves and the flowers, versus the heated, smoked, vaporized, etc. And what the studies are showing with fresh CBD acid, which is what is present in the live leaves and the trichomes of the flowers, very good at preventing diapedesis, which is the metastatic piece, in cell and tissue cultures. We need more studies, but the plant behaves very differently. And I'd also just like to point out, while I have everybody's ear, that not all types of cannabis get somebody high. When we have an active legal market, there is a whole spectrum of cannabinoids that are available. And there are more different types of cannabis than there are different kinds of dogs, for example. If we do have a little time, I don't know if it's, I know that Dr. Bridget spoke about this. I'm very interested in, if you know anything, Dr. Stefan, about how the Egyptians combined the bee therapy with the cannabinoids, or maybe you know a little bit about that while we're waiting for some audience questions.
I don't know what used the Egyptians. I know that Egyptians used a lot propolis, so honey for the wounds. In the papyrus Ebers, there are many recipes the Egyptians used against many diseases, and they used like in 50% at least of these recipes, honey was used. And it's also in Ayurvedic medicine, Chinese medicine, honey is used, but for two reasons. One is that honey contains active substances like against tumor. Honey, for example, is very good against metastasis in the digestive system. But also honey is a very good vehicle. So it's like when you want to get cannabinoids, for example, faster into the bloodstream, if you give them with some honey in the liquids, what happens when honey arrives into the digestive tract? Imagine that you are a cell in the small intestine, in that villi which absorbs the nutrients. And when you see coming honey, you say, wow, honey is coming, I want to absorb it. So then you see, oh, honey comes with some bitter substances, some sour or some funny kind of substances, which are not so likable. But you say, oh, I want though that honey. So because honey is glued more or less with those other substances which are not so likable, but they are therapeutical, then the small intestine absorbs this complex. So this kind of effect was known by Chinese medicine, by Ayurvedic medicine for thousands of years. And that is why in apitherapy, it's always good to combine propolis, royal jelly, pollen, bee bread, epilarnil, and so on in cocktails, which contains, of course, also honey. Now, there is a debate that cancer is feeding on sugar. And I would like to make a very important consideration here, very important point. Honey is not sugar. I repeat, honey is not sugar. If you look to the biochemistry of sugar, sugar is sucrose, and sucrose, it's a molecule which is made of two molecules, glucose and fructose together, okay? So, and if you look how much sucrose it's in honey, you get maximum 2% in normal honey. And in honeydew honey, it's even less than 1%. So you cannot say that honey is sugar, first of all, from the biochemical point of view. Now, honey contains all kinds of other polyphenols, minerals, acids, and so on, which are excellent for the immune system. So, and when you give the honey to the patients through the mouth, sublingual, or even suppositories and so on, you feed all the rest of the body, the immune system. So you strengthen this one. So you should not have problem with this, yeah? So, yeah, it's the combination which is the secret, and getting all these things with the strong heat, strong psychic, and this fight, non-stop fight, should be against depression. And using cannabis, it's of course a very good idea. And not only cannabis, there are many other medicinal plants which are good against the depression. So they can be used to.
And that's the thing and I addressed this a little in my talk, but there are many large numbers of plants that affect the endocannabinoid system. What I find very curious are that when the bees pollinate hemp flowers, there will be CBD in the honey, not in high concentrations, of course, but it's present. And if you are a student or a supporter of homeopathy, it's almost like there's a homeopathic property from the cannabinoids. I know that's controversial for some folks, but I just thought I would bring it up. But what's not controversial, and I hope everybody knows already, but if you don't, that the CBD is also very good for the immune system of the bees. And this will again be in my talk. I briefly present the paper. But bees that are pollinating cannabis flowers is very good for their immune system on multiple levels. And we now have some published literature on that. So I find that super exciting. I absolutely agree, especially for I've mispronounced the Ayurvedic word, but for kapha types, always better with exercise. Like the endocannabinoid system, exercise and good diet are multi-system activators. They affect multiple pathways and areas of the body. I know I'm speaking reductionistically, but it's just a way to communicate. So utilizing multiple therapies, and if the body is not being properly fed, it's not ever going to work properly. And also if it's not being properly rested. For a lot of cancer patients who are inactive, it's hard to rest. They get agitation. Cannabinoids can be very helpful for that, but so also can exercise. And I was delighted to hear from John's story how he had trouble standing for much more than 15 or 20 minutes supported. And now he can fish on his feet all day. When we repair the musculoskeletal elements that are holding us back using apitherapy and others, that allows us to exercise the body more. Depending on the fragility of the patient and certain factors, if they're not able to exercise, you can also create stimulation with hot-cold alternating therapies. But I think fundamentally, nutrition is the form and the basis and the bedrock, because if you don't have good nutrition, you're not going to exercise well. If you're not moving the body, you're not going to rest well. And so what strikes me as really wonderful about the cutting edge of science is that we are now beginning to understand, not only with modern cancer therapy, but with complex neurologic diseases, that we can use multiple approaches with pharmacologic drugs that allows lower doses, which means less toxicity, but with natural products, that means more of a supportive element. Also, when detoxing the body, you also have to make, especially if the patient is frail, you really have to make sure that there's a nutritive element. And I see the apitherapy, the honey, the bee products being very useful for this. Any thoughts on that? And I'm sure we'd love to take some audience questions. If anybody could get a question to the moderator, we could answer that as well. But any thoughts on that, Dr. Stefan?
First of all, about the hemp, the bees pollinating the hemp. And one question, because you are in this kind of industry and you have many contacts on this one, it would be fantastic, Jake, if you can get hemp pollen and analyze it a bit like sensorial analysis of hemp pollen, maybe biochemistry of hemp pollen, because this can connect very well cannabis with apitherapy. We may discover some very interesting properties in hemp pollen. And if you can find beekeepers which can collect this hemp pollen, it will be very good to have their address, because they can sell this hemp pollen to the patients and so on and so on. One topic here, you mentioned about the rest. And yes, this is very, very important. And because during a very good relaxation, a very good sleep, the blood flows very well in the body, and the immune system can also fight better the tumors, metastasis, and so on and so on. So here, one suggestion would be for John to learn more on techniques of relaxation, techniques of meditation, rules of getting a very, very good healthy sleep, and all this area. And yoga is very good for these kind of things of getting a very good relaxation of the body, but also the meditation techniques. So it was a very, very good discussion, Jake. I see that our participants are kind of shy. They are not putting questions in the chat area, but I'm sure they'll write us questions through email system later on after they listen to you too. So it's great to have you here in our family, because it's kind of joining two very powerful areas.
Thank you so much. It was really wonderful to hear your thoughts, your wisdom, and people. This is a medicine for all of us, for all of humanity. It is our birthright as humans to have access to this medicine, and this medicine was here long before we were. There's a long tradition of wisdom from many cultures, and just really thank you for listening.
Okay, thank you too. Thank you. Okay, yes. So I think we can close this round table. We have no questions still in the in the chat area. So indeed, it was wonderful, and let's hope we'll have a lot of feedbacks from our participants. Thank you again, Jake, and thank you everybody. Thank you. Bye bye.